Aphasia is a language disorder that affects a person's ability to communicate, understand, or use language. It is typically caused by damage to the brain, such as from a stroke, traumatic brain injury, or neurodegenerative disease. It typically occurs as a result of damage to the language centers of the brain, such as the left hemisphere. There are several types of aphasia, including 1. Broca's aphasia, also known as non-fluent or expressive aphasia. This type of aphasia affects a person's ability to speak fluently, but they may still be able to understand language and read and write. It is caused by damage to the frontal lobe of the brain and affects a person's ability to speak fluently. 1. People with Broca's aphasia may be able to understand language, but have difficulty expressing themselves. 2. Wernicke's aphasia, also known as fluent or receptive aphasia. This type of aphasia affects a person's ability to understand language and use words correctly, but they may still be able to speak fluently. 2. It is caused by damage to the temporal lobe of the brain and affects a person's ability to understand language. 2. People with Wernicke's aphasia may be able to speak fluently, but what they say may not make sense. 3. Global aphasia. This is the most severe type of aphasia and affects a person's ability to understand and produce language in any form, including speaking, reading, writing, and comprehending. 3. It is caused by extensive damage to multiple areas of the brain and affects a person's ability to speak, understand, read, and write. 4. Anomic aphasia. This type of aphasia affects a person's ability to recall and use the names of objects, people, and places. 4. Characterized by difficulty finding the right words to express oneself, even though a person may be able to understand language and speak fluently. 5. Conduction aphasia. This type of aphasia affects a person's ability to repeat words and phrases accurately, even though they may be able to understand and produce language otherwise. 5. It is caused by damage to the connections between the language centers of the brain and affects a person's ability to repeat words or phrases correctly. 6. Transcortical motor aphasia. This type of aphasia is similar to Broca's aphasia, but the person is still able to repeat words and phrases accurately. 6. It is caused by damage to the front part of the brain and affects a person's ability to speak fluently and initiate speech. 7. Transcortical sensory aphasia. This type of aphasia is similar to Wernicke's aphasia, but the person is still able to repeat words and phrases accurately. 7. It is caused by damage to the parietal lobe of the brain and affects a person's ability to understand language and use language appropriately, but they may still be able. 7. It's worth noting that the severity and specific symptoms of aphasia can vary widely depending on the individual and the location and extent of the brain damage. Speech therapist role.